how are you planning to further engage youth and to tailor and communicate guidelines for their behaviors and constraints?
So with respect to youth, I think this is a really important question, and I don't know if Minister Dix has anything further to add, but I'm glad you're asking about youth, and I'm glad you're asking about young adults. One of the first steps of engagement was, of course, with our COVID Speak survey, and one of the things that youth and young adults have told us is that they are actually feeling a lot of the consequences of the pandemic, but the pandemic itself, as well as our control measures in terms of mental health, in terms of ability to make ends meet. So one of our goals through our schools and through our communication plan is to make sure that we engage with young people through their universities, through their workplaces, to really consider what their needs are to gather what are the safe ways of doing so. So I think it's a really good question and a really good goal. It's something that we are developing a proactive communication strategy to specific communities and specific sectors of our society so that we can look at their needs in order to gather safely, in order to limit their numbers to small numbers and make sure that they meet their needs in terms of work and education. And Minister Dix, I think, has further details to add.
Yeah, thank you. It certainly is something that I've been doing over the last number of months, is a lot of Zoom calls with young people and seeking, because I think communication to young people is best often carried out by young people. And so we've been seeking influencers. We're asking people to be part of health authority campaigns, to be influencers of one another. We're obviously reaching out broadly to communities. If you look at Fraser Health, you look at the relative number of people that are hospitalized against the number of people who have tested positive for COVID-19, you'll see that a number of certainly the evidence of severe illness isn't there as much, and this can have some consequences in the way that people see the pandemic themselves. So we need to engage young people. They're affected by this, and they have paid a significant price. I do want to say, though, that many of our leaders in this effort have been young people in communities, and I very much appreciate their efforts. And I also want to say how much I appreciate the work done every day by people both at the post-secondary level, but also obviously in schools, both elementary and secondary. In BC, the role that and the leadership shown by teachers at the classroom level with another group of youth, people under 19, who are obviously have also paid a significant price in the pandemic, the loss for many of them for months of in-class education, all the consequences that come to that. And I want to express my appreciation to the young people who are showing leadership out there. We need more of you, and to teachers and others who are playing an extraordinary role. We're grateful for all your efforts.
Do you have a follow-up, Moira?
I do. Obviously, we won't know the exact impact of last week's social gathering order for another week or so. So I'm just wondering, what would the next step of orders or of guidelines be if we don't see that have a positive impact, a negative impact, but a good impact on the number of cases that we are seeing in BC?
So with respect to how we look at our interventions, how we design our interventions, we look at where transmission is occurring. That is our guidance for designing interventions, for delivering interventions. We look at where transmission is occurring, and we address the problem. And I think that's really important. If you look back at the interventions, the guidelines, and the orders that have been put in place, they were in response to ongoing transmission in certain settings, in certain related to certain activities. So the question of what the next guideline would be or what the next order would be really depends on what the transmission is like. And I think that's one of the things that I would like to emphasize. I think it's important for people to know that thought goes into all of this all the time. And one of the things that we do in British Columbia and, of course, throughout the world is to monitor this epidemic and respond to where the problem actually occurs, where transmission actually occurs. It's a science-based response, so it's not something that we can predict ahead of time, but we certainly are monitoring the data all the time, and we are responding to the data.